Hi, good day everyone. My name is Dominic J. Alwad, 17 years old, a grade 12 student from Central Isabela Christian Academy. Central Isabela Christian Academy are located at Maranak First, City of Ilagan, Isabela. So today, I would like to share about my experiences in our work immersion. We have given 9 days at least. So, I have my portfolio in here. I wrote some diaries about the activities that are happens to me during the work immersion day. So, first day. On the first day of our work immersion, we are 12 that are assigned in CHO1 or City Health Office 1 in Ilagan, Isabela, and were distributed by twos. Everyone was given a task, and Edwin and I, so Edwin is my partner. Edwin, Edwin and I were assigned to the Family Planning or National Immunization Program. We call that FP or NIP in exactly 9:05 a.m. In FP and NIP, they discuss about the different types of vaccines that are needed to the newborn babies up to 12 months old. They also showed us the medicines that they use to vaccine babies. Then we also learned about the exact years or exact time to have a new babies about the family planning. So the first day was done at 4 p.m. We logged out and after that we went home. So in the second day of our work immersion, Edwin and I was assigned to the laboratory at exactly 7:58 a.m. The laboratory is one of the rooms that I like to enter the most because it is the one of the most exciting places in the CHO1. They showed us the different types of machines that they use in the laboratory like gene expert machine, CBC machine, and microscope. They also allowed us to look at the microscope and we saw some puzzles, calcium oxalate like that. So in that time, that was my first time looking at the microscope. So it's so exciting and enjoying. When the afternoon came, Mama Rivik taught us all what to do in RH or CHO1. Mama Rivik told us the meaning of gather. Gather in CHO1. So G, it means greet. So when you see some patients or some staff, always greet good afternoon ma'am, like that. Because it gives some good vibes to them. So next is A. A stands for ask. Ask the patients what are the things that you can do for them. Um, ask if ask the patients what are the things that they needed. T, it means tell. After you ask, tell them what are the right thing to do or what are the places that they need to go. H stands for help. Help them, assist them. And E, it means emphasize. And R, it means refer. So, after Mama Rivik lecture, we logged out and before we went home, we took a picture of the staff. So, sorry for the background noises because I'm really in the outside of our house in the terrace right now. So, sorry for the unnecessary noises. On the third day of our work immersion, Edwin and I was assigned to the pharmacy. When we entered, we were exposed to the many and different types of medicine. The first thing that we observed in the room is, is that you need to have some good understanding to patient and have the long patience, of course. We also discussed the uses of medicine and we learned how to compute the exact dosage of medicine for the patients. Um, then, when 5 p.m. came, we logged out to the Mama Rivik office. On the fourth day of our work immersion, me and Edwin was assigned to the admission area. We learned how to height and weight and also converted pounds to the kilograms. The staff in admission area was so kind and approachable. It is really hard to assign in the admission area because there are a lot of patients that you may need to assist, but I have truly enjoyed it. So, on the fifth day of our work immersion, Edwin and I were assigned to the Animal Bite Treatment Center or ABTC. We assisted the patients and we arranged the papers of the patients. In the afternoon, there were not many patients left. That's why the staff decided to lecture us about the rabies. We learned a lot about the rabies, like what are the right thing to do if you are bitten a cat or a dog. We also learned the symptoms of being infected with rabies, and one of the worst words that really goes into my mind is when you are infected in rabies, there is no chance that you can cure it because rabies is uncurable. So, in the sixth day of our work immersion, Edwin and I were assigned to the TB dots. TB dots means Tuberculosis Direct Observed Treatment Center. In this area, we've learned about the Mycobacterium tuberculosis and also what are the symptoms of tuberculosis. They also discuss about the Mycobacterium tuberculosis is inborn virus. They also discuss the medicine that they give to the patients like rifampicin, isoniazid, pyrazinamide, and ethambutol. Sorry for the noises. On the seventh day of our work immersion, me and Edwin were assigned again in the laboratory. They discuss about the HIV or human immunodeficiency virus. We arranged equipment to the urinalysis and the sputum test. And in this day, we didn't do much on the seventh day. So it also on the eighth day of our work immersion, Ma'am Marivic took us to the field, visits the people, and also we helped the staff to arrange the gift that will be given to those who participated in Zumba dancing. In this day, it's super enjoyable and super exciting because in community center there was a lot of people, there was a lot of patients that we assist, and it is really enjoyed because there are zumbas, dancing like that. On the ninth day of our work immersion, this is our last day. Me and Edwin were assigned to the pharmacy together with Cyril Simon and Kim from INHS or Isabela National High School. The afternoon, in the afternoon, we took the exam and we reported. We reported about the rabies. After our report, me and my classmates were given a certificate of completion one by one. After giving the certificate of completion, we took a picture with the staff, doctor, and medtech of CHO1 Ilagan. And we also thank every staff member, especially on the head of CHO1. And before we went home, we first took a picture with INHS students who are also doing work who were also doing work immersion at CHO1. So that are the activities that are happened to me during my work immersion. Then my reflection essay during my 9 day in City Health Office 1 in Ilagan, I accumulate I accumulated numerous memorable experiences that will stay with me indefinitely. This work immersion provided me with the valuable lessons, the foremost being about animal rabies. During our time there, we briefed on what action to take if bitten is caged by a dog or cat, emphasizing the use of running water and detergent soap. Additionally, I gained insights into the transmission of HIV/AIDS, which include sharing needles and engaging with unprotected sexual contact, and receiving blood transfu- transfusions. In pharmacy department, I learned the importance of documenting medication intake by patients and the proper engagement of medicines. In the admission section, I assisted patient in the record office and acquired skills using the pulse oximeter. At the TB dots units, I comprehended the cause of tuberculosis, primarily due to the mycobacteria, and I understood the necessity of consulting a doctor if the symptoms persist for the more than 2 weeks. Moreover, this work immersion understood the significance of teamwork, and my classmate and I demonstrated the effective of teamwork, enabling us to complete tasks with the allotted time frame. So that's all. Thank you so much for listening. I hope you like it. Bye bye.